Hi, I'm Orange Juice, but you can call me OJ for short, and I will be your host today with Lamb Chop. Our directors are Randy Bates, Teresa Dybel, Catherine Stoltz, and Elizabeth Philbrick from the Ohio State University College of Nursing. I'm here with teacher Lamb Chop to discuss type 1 diabetes.
Oh yes, I have a student in my class with diabetes and it makes me very nervous.
It is true that students with type 1 diabetes have special needs, but I hope if we review how to recognize and handle a diabetic emergency, you might feel a little less nervous.
Okay, that sounds good.
So your student's doctor or nurse practitioner will have a plan called a diabetic management plan in place for how often he should be checking his blood sugar and how often he should be administering insulin. Generally, blood glucose levels between 70 and 130 before meals and less than 180 2 hours after eating are standard target ranges. Finding that it is low on a meter is one way to know that it is out of range, and the student may also have signs and symptoms of high or low blood sugar.
Oh geez, that sounds scary.
It can be scary, teacher Lamb Chop, but if you know what to look for, you might find it earlier to prevent an emergency. Low blood sugar, or hypoglycemia, is under 70 on a meter. High blood sugar, or hyperglycemia, is when blood glucose is higher than target range.
You said before the student might show signs or symptoms of hyper and hypoglycemia that I might recognize. What are those?
Signs and symptoms of hyperglycemia, or high blood sugar, are thirst, increased urination, loss of appetite, fatigue, inattention.
Huh? What?
Lamb Chop, over here.
Oh.
And later, signs might be rapid breathing with a fruity odor to the breath, and nausea and vomiting.
Like, I don't do well with vomit. Well, it sounds like I should be on the lookout if my student is needing to go to the bathroom frequently and is needing more water than usual.
Yes, that's very good.
So, what should I do if I notice these signs in my student? Should I ask the student how he's feeling and suggest that he take his blood sugar?
Yes, if it is high, he will require insulin, and this should be guided by the student's diabetic medical management plan.
Oh, I don't want that to happen to my student.
Well, if the student is on his own and he is not able to manage it, call for the school nurse or follow your school's protocol for getting help. If hyperglycemia is not treated, it could lead to a life-threatening situation, sometimes called diabetic coma.
That sounds awful. I don't want that to happen. So what about hypoglycemia or low blood sugar?
Hypoglycemia is when blood sugar is below 70. Early or mild symptoms of hypoglycemia include drowsiness and weakness, shaking and sweating, anxiety,
Oh my goodness.
paleness,
Well, I'm already as pale white as I come.
dilated pupils and blurry vision.
I don't think my eyes dilate.
Moderate or progressive signs of hypoglycemia happen as blood sugar continues to drop. You might see restlessness, irritability, or confusion.
What? Where's my edge? Wait, peaches? Oh, jeez, I'm going to the park.
Lamb Chop, I'm worried about you. Hypoglycemia may also cause excessive yawning or sudden crying. Oh, it's okay, Lamb Chop. Dazed appearance or staring, extreme fatigue. Lamb Chop, now I'm really confused about you. Oh, I'm concerned, not confused. These symptoms and signs can progress very quickly, so it is best if both the teacher and student are in tune with what to look out for. Severe symptoms of hypoglycemia can include inability to swallow, unconsciousness, and seizures.
Oh my, that is awful. I hope to never see that.
I hope so too, and that is why early recognition of hypoglycemia is very important. In the early stages of hypoglycemia, it can be easily treated. Any incidence of hypoglycemia that is an urgent situation, but can be prevented from going into an emergent situation.
So what should I do if I recognize these symptoms?
Treat for hypoglycemia based on the student's diabetic medical management plan. This usually includes having the student consume 15 grams of a fast-acting carbohydrate if they're still able to swallow.
Oh, so this looks like it might be 4 ounces of fruit juice, 3 to 4 glucose tablets, 6 to 8 ounces of a sports drink, 6 ounces of regular soda, or 3 tablespoons of table sugar. Then what?
That's right, Lamb Chop. If the student's symptoms haven't improved in 10 to 15 minutes, have the student consume another 15 grams of fast-acting carbohydrate. Then follow your school's policy for emergency medical care and tell the school nurse to assist in the meantime. If the student becomes unconscious or begins to seize, emergency medical care should be sought immediately if it's not already in progress. Do not try to give the student anything to eat or drink if he is unconscious, seizing, or unable to swallow.
So, I think the school nurse can give glucagon. She said that was a medication that stimulates sugar to be released in the body. So, it sounds like she should give that if somebody is available to do that.
Very good, Lamb Chop. And if at any time you suspect hypoglycemia, do not leave the student alone.
Oh my goodness, this is so overwhelming. I think I need something written on paper to have for reference.
That's a great idea. Also, you should have a copy of each student's diabetic medical management plan to refer to in any situation in which you may be able or need to aid the student.
Whew, I feel more comfortable having a student with diabetes in my classroom. So I'm so glad that I have a school nurse to be a reference.
That's great. Just remember to be understanding that students with diabetes may require more bathroom breaks and may need to carry around water bottles. These students may also need more time to check their blood sugar and administer insulin. Do not forget that while these students have special needs, they should be included in every activity and can carry out having very normal lives. Thanks for watching.